Let me know if you have any questions. This is very conversational. You might have to interrupt me because I can't see you. I can't see any hands or anything. And I won't know if you're laughing at my corny insurance jokes, but I'm going to pretend like you all are. So I'm just going to dive right on in here. Okay, so the agenda, we're just going to go over what's new this year. It is quite a bit of new information, so I'm sorry if you feel overwhelmed or anything like that. I am going to be available for questions, and we also have the Benefit Advocate Center for questions, which I'll go over on the next slide, I believe. We'll go over the plans, how they work, and then when I'm done with my part, Andrew's going to jump in and go over a little bit of retirement information. And then we'll open up for questions at the end as well. Can everyone hear me okay?
Yes. Yes.
Perfect. Okay, so Gallagher, so that's where I work. We have our own specific Benefit Advocate Center just for Capital. So that means that when you call in, you're not going to have to wait and get transferred around and what's your number, what's your group number. They pick up the phone and they say Capital Home Health, and they know your benefits and they know what you're looking for. So this is going to be something like, I need help with a claim. Why is this getting paid this way? I need a new ID card. I need help seeing if my provider's in network. They can help with all types of things, from really easy to, really complicated. You can either email or call, and their turnaround time is pretty quick. So I would give it a try if you ever need help in those regards. And they are open a little earlier, and they stay open a little later too, just in case you can't make the normal 8 to 5. Okay, carriers. So like I said, a lot is changing. For medical, dental, and vision, you're going to be moving to Humana. And on the life and disability, you're going to be moving to Mutual of Omaha. The only thing that's going to be staying the same is the COBRA administration through Afinisource. But, you don't really have to worry about that unless you plan on leaving or getting off the plan. So we'll go over all of these individually, and I'll explain all the changes. Okay, so what is open enrollment, right? So open enrollment is right now. It started on the 16th, and it's going to go until the 30th. So iSolved has been open since then, and it will close on the 30th. You have to go into iSolved and make your elections by the 30th, or you will not have insurance effective October 1st. Please make sure to go in and make your elections. If you have questions and you don't know how to do something, or you feel stuck, ask Rachel. She would much rather help you than you come to her saying you couldn't do it and you couldn't make the time. So this is the only time during the year that you can make changes unless you have a qualifying event, which is what I'm going to go over right now. So a qualifying event is basically a life event that you need to possibly review your benefit elections and make changes. So if you get married, you add your spouse, or you can get rid of a spouse too. You have a baby, you need to add your baby, or perhaps it's your spouse's open enrollment. That's a qualifying event. So if it's your spouse's open enrollment, you could actually drop your coverage and get on their plan if that's something that you wanted to do. You would just have to make sure that with all of these qualifying events, that the day of the event, you make sure that you make those changes within 30 days per IRS. So if you have a qualifying event, if you're getting married, divorced, having a kid, whichever, just let Rachel know so she can go into iSolve and do everything correctly. Does anyone have any questions about what a qualifying event is?
Nope.
Nope. Okay. All right, so now we're going to dive into the medical. And like I said, if you have any questions, just let me know. We're about to go over a lot of information. A new plan is being offered this year. It's called a high deductible health plan. So this works differently than the plans that you have now. So if you can see, the annual deductible is $4,000 for individual and $8,000 for family. And the out-of-pocket maximum is $6,350 and $2,700. So Out-of-pocket maximum, I like to consider it worst case scenario. So that is the most that you're going to pay for an individual or for your family for a calendar year. So on a high deductible health plan, when you go to the doctor, you don't pay a copay. There are no copays on the plan. You go, and then whatever services you have, the provider bills the insurance company provides their discount, and then you get a bill in the mail later. And so you're paying everything for the billed amount up to the $4,000. And then once you hit the $4,000, you'll only pay 20% of the billed amount. Humana will pick up 80 until you reach the $6,350, which is really only $2,350 because that $4,000 deductible is included in the $6,350. Once you meet that, you're covered for the rest of the year at 100%. So I'll just go over a couple examples real quick. So I'm sure most of you are used to going to the doctor and paying a copay. Like on the other two plans offered that we're going to be offering, it's a $35 copay for senior primary care. So if you pick this plan, you could be billed anywhere from $50 to about $120, just a guesstimate, depending on what your services are and what kind of doctor it is. And a lot of people are like, why would I want to do that when I can have a $35 copay? Well, with a high deductible health plan, you can open a health savings account, which is also new this year, and I'm going to go into way more detail in a few slides as well. But what a health savings account does is it takes pre-tax dollars and puts it into your own personal bank account. Capital doesn't own the bank account. It's your bank account. And you can use that for medical, dental, vision expenses. So if you want to fill up your health savings account with the maximum amount, you could just use those dollars to pay for these services, and almost up to the $4,000 because the limit is $3,550, which I know I just said a bunch of numbers. We'll go over that in a few minutes. But the high deductible health plan, a lot of people are scared of it because there are no copays, and they think that $4,000 is, pretty high to get to. But really, when you do the math, when you're talking about premium, because the high deductible health plan is the most affordable plan when it comes to the contributions and the pre-tax dollars that you can save to pay for your medical expenses. And also with the health savings account, that can help you later on when it comes time to retire. But we'll go over that in just a few minutes. So does anyone have any questions about how a high deductible health plan works? No? Okay. So no matter which plan you pick, all three of them in front of you, preventative care is going to be covered at 100%, no copays, no anything. So you go and you have a physical once a year, it's going to be covered. If you have your well woman exam, it's going to be covered. I just wanted to make sure to point that out, that even on the high deductible health plan, it's still going to be free. So if we move over to the Humana HMO Plus, a lot of people, when they hear HMO, they get kind of freaked out because, oh, I'm going to need a referral. I'm going to need to pick a specific doctor. And that isn't the case with this plan. With this plan, HMO just means that you only have in-network benefits. So you would really need to make sure to go to humana.com, call the Benefit Advocate Center, whatever you would need to do just to make sure that the provider that you're seeing is in network so you can receive benefits. So this plan is a little bit more traditional when it comes to the benefits. So you have a $35 copay if you go see the doctor, a $60 copay if you go to the specialist. So that would be like a cardiologist, a podiatrist, something like that. There is a $350 copay if you go to the emergency room. And then if you have any tests or anything like that, it's going to be subject to the deductible. And there are copays on the prescription on this. So it's either $10, $35, or $55, depending on what tier it is. If you're on any specialty drugs, you will pay 25% or 35% of the billed amount. Does anyone have any questions?
Nope.
Everyone's so quiet. Okay. So on the PPO plan, it's pretty similar to the plan I was just talking about before, but it has in and out of network benefits. So for some reason, if you go out of network, you'll still have those benefits. But I do want to say that no matter what plan you pick, all three of them, if you're in a true emergency situation and you need to go to a hospital, and obviously you're not going to have time to go to Humana.com and look up to see if it's in network, it will be covered in network, no matter what. So on true emergencies, if you pick the HMO, I just want everyone to know that. So the PPO is pretty similar to the HMO when it comes to the benefits. So urgent care 75, copay for primary care and specialist 35.60, and then the same pharmacy benefits for the copays. What they're really doing on both the HMO and the PPO plans on the emergency room, they make that copay so much higher to try to keep you out of the emergency room for your sake and for the carrier's sake, right? So they're trying to say, you know, is this really an emergency? And if it's not, you know, perhaps you could go to the urgent care or your primary care or use a virtual visit, which I'll go over as well. When you go to the emergency room, some people just go just for convenience. They can't get an appointment and they just want to go and get it over with. I don't know if a lot of people know this, but if it isn't an emergency, the doctor can code it that way and then it won't be covered. So a lot of times we try to say, obviously, if you have an emergency, go to the emergency room, but if it can wait, try to get into an urgent care or your primary care just to save you money and just to make sure it's going to be covered. Okay. Does anyone have any questions about the medical plans and how they work?
I have a question. Can you explain the difference between HMO and the PPO for the insurance?
Sure. So the HMO has no out-of-network benefits, and then the PPO does. So if you go into iSolved, it has benefit summaries for all three of these plans with a lot more information. This is all just very high level. It has, on the PPO, it has what out-of-network benefits it has, and on the HMO, it has a lot more information about the plan and how it works. Does that answer your question?
Yeah.
Okay. On the deductible, on the high deductible plan, on the medication, so you have to meet your medication deductible, or it's the full 4,000?
It's 4,000 for everything. So if you have a specialty drug and it's really expensive, you're going to meet that 4,000 pretty quick.
Mm-hmm. And then one other question on the in-network only, the HMO plan. So you said that it would be covered if you went into the emergency room and it was a true emergency. What about if you're admitted and then you can't control, I guess, who you're being consulted with, and they may not in-network? How does that work?
Right. So, I mean, this happens to everyone regardless of the plans, right? If you go to the hospital and you get admitted, you see probably 4 or 5 different doctors coming in and out. You can't stop and ask every single one if they're in network. You can't, if you have to have a surgery, you can't ask your anesthesiologist if they're in network because you're asleep. So that is something that under law, under Texas law, the IRS law, that if that does happen, in a true emergency, they aren't allowed to balance bill you. So that means that you wouldn't have to pay the extra for that out-of-network charge if it's a true emergency and you get admitted.
Okay, thank you.
Sure.
To like if you're in a car accident or something major.
All right, so I'm gonna talk about wellness real quick. So this is new with Humana. This is a really, really great benefit, and it's great for you. It's great for the company. So I'm just going to go over a little bit of the information. It's called Go 365. And basically, Humana designed it so you can do fun, healthy living activities and earn money doing it. And everyone likes money, I would guess. So what you would do is you register online at go365.com, or you can download the app. But you would have to wait until you have your ID number. So you wouldn't be able to do this until October 1st when everything is effective. But you would go in and do your health assessment online. So this would be questions like, how are you sleeping? How's your stress? Do you hate your job? Stuff like that.
Why did you chuckle so loud?
But don't worry, they won't see your results. So then it'll give you like your health age or something like that. And basically that just gives you points. So the more points that you get, the more money you could get. So like, I think Rachel mentioned this earlier, completing a biometric screening. So if we get enough participation from you all, then we can get Humana to go out there and do a biometric screening. So that's just going to be like your basic, like a very mini physical. They're going to check your blood pressure and they might prick your finger for sugar and stuff like that, but it doesn't take more than 10 minutes. Just doing your preventative exams, so getting your teeth cleaned, getting your eye exam, having your physical, maybe donating some blood, getting a flu shot, just things that people usually do anyway. If you go in and you mark down and Go 365 that you're doing it, you get points. So there's something called Go 365 Mall. And in the mall, you can get enough points to receive gift cards at Amazon, Target, Lowe's, Fitbit, Spa Finder, which is something that you could get gift cards for massage and fitness and yoga and all kinds of stuff. So I don't know anyone who wouldn't love a gift card from Amazon. Like, you could get anything on Amazon these days. So the more that you do and the more points that you get, the more money you could get. So another great benefit to this is one that helps you and capital as well. So if we get enough participation with the Go 365 program, what happens is there's different levels of status. So you start at what, like bronze, silver, gold, platinum. I don't know if that's in the right order. I can never remember. But if you get enough people to get points and be active, then it's possible that capital can receive discounts on renewals, which means that your premium next year has potential to be less.
Yeah.
So it could possibly save you money as well.
Right.
So save you money, you're getting money, and you're trying to be active and healthy.
Yes. So, our premium for like employee only this year is like on the base plan is like around $100 a month. That could decrease next year if enough people participate, we get those discounts. And when they come back with our renewal rates, they're the same or close to the same or, however, or less, based on the participation here. And I know a bunch of people here have really gotten healthy in the past year. So this could be like fun and competitive too, because everyone could be like, ooh, I'm gold status or I'm platinum status. I'm really excited about this program, and Macy knows this. I'm also competitive. So I will be definitely like pitching this with everybody. You can participate or you can choose not to. It's just a fun thing that you do on your own. We don't see any of your results or anything. When they come in and do the biometric screening, it all goes straight to Humana. Okay?
Right. Rachel has said a million times she does not want to know. She doesn't want to know. So something that we do at Gallagher, we have a very similar program. And in our kitchen, we have a really big like whiteboard that you can draw on. So we have everyone's name that's participating, and we have everyone's points. And we get competitive with it as well. So it's just fun if you want to do that, or yeah, like you said, I know Rachel's competitive, so even without the money or without anything, I think she's really going to want someone to join her in the fun. So there's also in the booklet. So the booklet is an iSolve. There's a lot more information about this program as well.
The testing
Okay.
All testing is free under the biometric screening. So what'll happen is that the reason why I got you all to sign in is I want to find out what day works best for you. We have to have at least 10 people for them to come out here. They'll do it at the office. So 10 people here, you'll just come in and they'll do it. It takes like what, Macy, like 15 minutes, I think?
Yeah, no, I would say no longer than 15 or 20 minutes per person.
Right. And so what we'll do is we'll say, okay, guys, this is the day we're thinking. Who's down? And we'll make sure that, you know, everyone can you'll get an invite. You can put it on your calendar. They'll come out here, do the screening. And you can like sign up last minute too, but I need at least like 10. So ideally I'll probably have 10 to 15, or I would say like 15 to 20. That way, in case anyone just absolutely can't make it that day, we still have the minimum amount that we need to. Okay?
Perfect. All right, so now I'm going to go back to the health savings account. I promised I would go over this a little bit more since I know it's a new benefit and I'm sure you have questions. Sorry, my voice keeps going in and out. So if you want to open a health savings account, you have to be on the high deductible health plan. You can't be on either the HMO or the PPO. Per the IRS, that's not my rule, that's your rule. Also, something to consider is if your spouse has medical benefits and they have an FSA, a flexible spending account, you cannot have an HSA. So the IRS is basically saying you can't have that many pre-tax dollars in your family. Like that's too much and we don't like it. So, and what an HSA is an HSA is your money, your bank account. It rolls over from year to year. No, you know, you're not going to lose it. It can be used later in life for investment earnings when it comes to retirement. It grows in interest. It's, like I said, you're putting in money, they're tax-free. And if for any reason you decide to leave capital, which you won't, right? You take it with you. So it's just a really great benefit. As to some employers have a flexible spending account, and what a flexible spending account is you elect the certain amount of money that you would like, but if you don't use it by the end of the year, you lose it. So a health savings account is really a better benefit because if for some reason you're not going to use those dollars, it'll just keep growing and growing. So there are maximums on the contributions. So if you're an employee only, you can only put in $3,550 for the calendar year. If you have a family, you can put in $7,100. I know they're weird amounts. They go up either $50 or $100 every year. So just keep that in mind. And what you can do, you can put in the full amount. You can put in, you know, $200, whatever you decide. It's going to be whenever they do payroll, it'll just be taken out of your paycheck pre-tax to put into the account. So a lot of times what people do is they put money in there and then they don't even use it, right? They just let it grow interest to have like a separate little retirement fund, because once you hit retirement age, you can actually use those dollars for other expenses that aren't qualified healthcare expenses. So a few things that I just want to say a few examples that you can use your HSA for, you know, co-insurance payments, co-pays, the dentist, prescription drugs, ambulance service, chiropractor, glasses, hearing devices, therapist, acupuncture. You know, the list is kind of endless. I think if you go to the IRS website, I believe there's a 200-page document of stuff you can use with the HSA. I just like to make sure that everyone knows that it's your responsibility to keep your receipts in case you ever get audited by the IRS.
Mhm.
Because if they find out that you're using these pre-tax dollars to buy flat screen TVs, and you don't have the proof that you had $1,000 worth of medical expenses, then you're going to be in trouble with the IRS. So that's your responsibility as an employee to remember that you keep track of that. But also, an explanation of benefits is considered a receipt. So whenever you have access to the Humana portal, you're going to be able to view your explanations of benefits for all of your claims. And then, you can keep those, you can print them, or you could just have them online and pull them whenever necessary. So whichever way you'd like to do it. I know a lot of people just like to keep a huge drawer full of receipts just because. So whatever is more convenient for you. But overall, the health savings account really is a great benefit, and you really can't lose with it either way because you're getting, free money, those pre-tax dollars. So does anyone have any questions about what a health savings account is, how it works?
Yes, I have a question. So, like now we're changing accounts or insurance. So if we ever get to that point where we're not with Humana and not have this health save, what happens to those monies?
Oh, it's yours. It's like a bank account. It just kind of sits there and it grows interest. So HSAs can just, they go with you. So it'll be with Infinisource. It's like a bank account that you have. You can use it for anything medical related. And when or if you leave, or if we don't offer an HDHP plan anymore, you just can't contribute to it anymore because you have to be on an HDHP plan in order to contribute. But that money just kind of sits in there and waits. And like you can wait until retirement. You can just sit on it and you can use it.
Right. It's not going to go anywhere.
But even if you don't have Humana any longer, you can still use it for any of your medical related payments.
Yes, you don't
You
lose
just
it.
save your receipts.
Yeah, it's not an FSA. FSAs you lose, but they also have different benefits to having them. So
Right.
money is yours. It's just think about it. And someone asked a really great question the other day. They said, well, why shouldn't I just save in my own savings account? Well, this money's coming out pre-tax, so it makes your taxable income look less to the IRS, so less you have to pay in taxes to the tax man. And then you can actually use that money and it never gets taxed at all.
So essentially it's almost meeting your $4,000 deductible for the year.
Well, yeah, almost. Or if you're like me, here's a good example. I am not typically sick, don't go to the doctor often. And I do physical therapy, but I pay cash for it. And since I pay cash for it, if I put that money away in my HSA, I'm never paying taxes on that money that I'm already spending right now in cash.
Yep.
So
Exactly.
it's helpful.
That answer it, Kevin?
Yes.
Okay. And like I said, if anyone else has any other questions, I'll pause again for questions at the end, or you can email Rachel and she can forward it to me. Either way, because I know more stuff is going to pop up. So just move on. Okay, so premiums. What's going to come out of your paycheck? This is what everyone really cares about, right? So the strategy this year with the contributions had to be different. So with Aetna, your current medical carrier right now, when Gallagher, myself, received the renewal, Aetna gave Capital a 50% increase. So we had to go out to the market, and that's the reason that we're moving to Humana, because they gave us a more reasonable quote, basically, if you want me to get into the weeds of it. So what we did was we worked with Capital to change up the defined contribution. So before, I know some people were paying nothing and some people were paying something, but now what Capital is doing is just picking a certain percentage and paying the same percentage all the way down. So right now they're contributing 75% to all tiers, no matter which plan you're on or which tier you're in. It's something that they did to try to make it to where it's fair for everyone and to be more in line in the market and with what other industries are doing as well.
Sure. And so just to know, if you guys have like family or spousal plans right now, I know on the highest, the buy-up plan, your increased premiums, if you are on the PPO right now with family, it's somewhere around $500 a paycheck. That's going to drop all the way down to $210.85 a paycheck. So you're essentially going to have $600 extra every month. Okay? Question?
Okay. All right, so we're almost done with medical, and then everything else should be easy peasy. So just a few things I wanted to point out because we are moving medical plans. Your deductible, right? So your deductible runs from January to December, even though your plan year starts in October. So if you've met your deductible already, it's going to be moved to Humana. So what you can do is, if you know for sure that you've already met your deductible and or out of pocket, you can download your most recent explanation of benefits from the Aetna website. On the bottom, it should say how much you've met of either your deductible or out of pocket, and you can send it to Rachel. She can send it to me, and I'll send it to the Benefit Advocate Center, and then they send it to Humana and get it uploaded. This is going to be done for everyone. October 1st, I'm going to request a report from Aetna so we can get everything moved over. But I just like to tell people it does take sometimes 3 to 4 weeks to get that deductible credit applied. So if you have something scheduled for the first 2 weeks of October, I would just keep that in mind, a surgery, some kind of expensive test. Your deductible may not be credited by then, but it will reprocess and it will be right eventually. And also, if you had to get any authorizations for any special kinds of medications, unfortunately, you're going to have to get a new one. Every time you move medical carriers, they need a new authorization. And we like to make sure to say to fill your prescriptions if you can before moving, before October 1st, just in case, October 1st or October 2nd, something's not in the system yet and you wouldn't want to not have those medications if you need them. You will be getting new ID cards. You should receive them in the first week of October. If you need to go to the doctor that first week, you can get with me and I can get with Humana to find out your ID number, and we can print it online as well. So there are ways, of course, to go to the doctor and get this information if you don't have your ID card yet. And just another reminder to make sure if you have providers that you go to on a regular basis to look at the new network and make sure that your provider is in network. In the booklet, the one that's in iSolve, the network names are on the first page. So even if you don't have your ID number yet, which you don't have to have that information. You could just search by network, depending on which plan you pick, and it'll tell you if your provider is going to be in network with Humana.
And those are going to
Any
be,
questions?
it says HSA and PPO. The network is National POS Open Access. For the HMO, it's HMO Premier. You'll see it's a drop-down menu. There's like 10 options, and you can pick one of those options.
What page is that on?
The first page, it's with all the information on the like each plan and the phone numbers and the websites and everything. It's in the second
Okay.
or third column, excuse me.
All right, so I'm going to move on to dental. So there are 2 plans offered, again, both by Humana. One of them is going to be a DHMO, and what that means is it's not traditional dental coverage. It's going to be you go in and you pay a specific copay for each services. So there is a fee schedule in iSolved, several pages long. But basically, if you choose a DHMO, you're going to know when you go in how much you're going to pay. You know, there's a specific cost for a filling. There's a specific cost if you get a tooth pulled. There's no deductible. There's no annual maximum. With this plan, you do have to pick a primary care dentist and enter their name in iSolved. There's going to be a little space where you can do that. So you would just need to stay with that primary care dentist. You are allowed to change your dentist if you want to. You would just go to humana.com, but it would most likely be until the next month that it would be in effect. A lot of people choose this plan just because it's half the cost of the PPO plan, and because they're gonna know what they're gonna pay. Those copays are right in front of them on a piece of paper instead of just going in and wondering what you're gonna be billed. So on the PPO plan, it's a more traditional plan. So for your cleanings and your x-rays, those are covered at 100%, no deductible. And then type 2 basic services. So these are going to be things like getting a filling, getting a tooth pulled, getting a root canal. You're going to pay a $50 deductible, and then Humana is going to pay 80%. You would be responsible for 20%. And then type 3, so this is going to be big stuff, crowns, bridges, dentures. You only have to pay that $50 once on the deductible. So then you would just be responsible for half of the billed amount. So on this plan, the annual maximum is $1,000. So Humana is saying that they won't pay more than $1,000 worth of dental coverage, but they do have a caveat that if you do meet your maximum of $1,000 and if you use an in-network dentist, you will receive 30% coinsurance on type 1, type 2, and type 3 services. So even if you go over that $1,000 on the dental plan, they're going to discount your cost by 30% to infinity. So that's a good benefit to have. And only Humana has that benefit as well on the dental. So one last thing about dental, and then I'll ask if there's any questions on it. So orthodontia, if you have a child and you're on the plan currently and you've already used the maximum, the $1,000, unfortunately, that's a lifetime benefit. So you wouldn't be able to use it on this plan again. A lifetime benefit is for life, and dental carriers are friends and they talk to each other. So Humana is going to know if you use that $1,000 already with your current carrier, if that makes sense. So if you haven't used it already, great. And if you have, there's that lifetime wording. So there are benefit summaries in iSolve with a lot more specifics about coverages and what falls under what tier, what kind of service. So like I said, this is all pretty high level. If you have any questions, you can go look at those or ask me. Costs. So dental and vision are becoming 100% voluntary. So you would be paying for this if you wanted this benefit. Like I said, the DHMO is about half the cost of the PPO plan. Again, the DHMO is you pick a primary care dentist and you know the cost of what you're gonna do when you get there. And then the PPO is the more traditional dental plan. Anyone have any questions?
I do. I'm a little confused about the portion of the annual maximum on the dental. So
Okay.
the PPO will only pay up to $1,000. So if you need dentures, I don't need dentures, but if you need dentures and your dentures are more than $1,000, which they will be,
Right.
you're responsible for anything additional.
Yes, Humana will pay 30% after the annual maximum of the billed amount, but anything other than that, you're responsible for.
And then on this other one, the HMO, that's unlimited, you won't know what the question was. You said that I would know exactly how much my dentures would be if I am on the HMO.
It would be in the fee schedule. Actually, I wonder.
I don't like a copay, yeah. So if it's in iSolve, if you open it up, it has like a list of all the services that they could potentially offer you. And last year we gave out a Guardian booklet that said the same thing. And then it'll say like dentures, and it'll give you the price tag that goes along with that. And then if there could be, I had this happen too, like on the DHMO plan, where like they'll pay a certain amount, so you pay whatever left over. I whatever the dentist charges you.
Right, yes.
But
So
you have the HDHP healthcare plan and an HSA. You can use the money in your HSA to pay the difference, technically.
yeah.
So there's ways around it.
Absolutely.
So for the Humana DPPO or what have you, for the child, if it's $1,000 lifetime max, I mean, if they end up needing braces or something, that's clearly well over $1,000. So you're paying out of pocket for the rest of their life. I don't understand.
Yeah. So they will pay $1,000 worth of the braces, and then after that, it's out of pocket.
Yeah. I still have some jacked up teeth.
Any other questions?
I have a question. What if, well, like myself, I've got a spouse that's not living in this area. So if I chose the DHMO, are there an area in iSolve to choose 2 different dentists?
So you would go to humana.com and find a provider, and I believe, let me see, here we go. I skipped ahead a little bit. You would go to coverage type, DHMO, put in the zip code of wherever that person was, put in that network right there that's on the screen, and it's also in the booklets as well. And then you could search to see what providers are in that area.
Yeah.
Does that answer your question?
Yes, ma'am. Thank you.
Oh, perfect. Okay.
Does it say how much these plans, like the dental and the vision on?
Yeah.
In the very back of the book.
Okay. So just a couple things that I'm going to wrap up on the dental. So if you choose the DHMO plan, you have to pick a dentist and go into iSolved and put in that dentist's name. And like I said, you can change the dentist if you want to, but there is a time. It takes a few days or until the next month to make that effective. And on the right here, it's just like a little sniff of what it looks like when you're looking at the network. You put either DHMO or PPO, your zip code, and then on the PPO, the network is going to be called Traditional Plus. And then on the DHMO, it's going to be called HS210 DHMO prepaid, blah, blah, blah. So I know it's a little confusing, but it really is the best way to make sure that you get everything in network and you get the best benefit. So on the PPO plan, you can see any in-network dentist. Staying in network is going to get you the best benefit. There are out-of-network benefits for dental, but they really don't pay out that much, so I wouldn't recommend it. And just another reminder about the orthodontia benefit is lifetime. And if no one has any questions, I'm gonna breeze through vision. So vision's also with Humana. So if you go and you get an eye exam, it's gonna be a $10 copay. Lenses are gonna be a $15 copay. You have a $130 allowance for frames, and once you get to that amount, then anything else is out of pocket. Same thing for contacts. So you can get an exam once a year, new lenses once a year, and new frames every other year. But I just like to point out that the frequency is a little bit different than medical and dental. So medical runs from January to December, and so does dental. But vision runs the 12 or 24 months since the last time that you received the service. So an exam, you have an exam in June, you have to wait until next June to the day to have an exam again. Same with lenses. You go and you get new lenses in April, you have to wait till next April for lenses. Does that make sense? So it's truly 12 months instead of a calendar year.
Macy, we had a question. That information comes over from Aetna. So if they got one last year, that counts, right? Or not Aetna?
It does not. It does not.
We're starting over new with Humana Vision.
You are starting over new.
Okay.
So if you got new glasses last month and then October 15th, you want to go and do it again, they know nothing about it.
Glasses, yeah, hurry up and go get glasses so you can get another pair of glasses this year if you want.
Exactly. Medical carriers talk to each other, dental carriers talk to each other, vision, I guess they're just not friends. I don't know. So that's one good thing about it, right? So there are out-of-network benefits. I wouldn't recommend them. What you would do if you do find yourself at an out-of-network vision provider is you would just pay what you owe and then file a claim and get reimbursed. Look at my little lizard or snake or whatever. Okay, so vision, this is per paycheck. Employee only $267, and then if you have any dependents, it's $686, no matter which tier. Okay, switching over to life and disability, because I know everyone wants to talk about this. So, hopefully no one ever has to use these benefits, but I'm still going to educate you about them anyway. So the life and disability is moving to Mutual of Omaha, and Capital pays for you to have a $25,000 life benefit. So if anything were to ever to happen to you and you were to pass away from an accident, then you would get an additional $25,000 with that accidental death and dismemberment benefit. So the dismemberment benefit, you don't have to, die to get that. The carriers say, we think if you lose your thumb, we'll give you $1,000. If you lose your leg, we'll give you a few more $1,000. Every single body part that you have that you can lose has a price tag on it. The carrier. So, hopefully no one gets dismembered, but if you do, just know you're going to get some money. Right? I know it's weird, it's morbid, but that's insurance. So like I said, you don't have to pay anything for this. Capital pays for it. But just make sure that in iSolved, everything is updated, including your beneficiaries. I have had in certain situations where people forgot to update their beneficiaries and like their ex-wives ended up getting their money. So I really doubt anyone would want that to happen. So just make sure it's updated. And I believe you only have to put one beneficiary in there, but if you want, you can put more than one.
Yes.
Is there a age limit on like children for benefits?
So we've had some discussions about this. So there isn't, but most likely if you have a dependent that's younger than 18, they wouldn't get any of that money until they were of age.
Okay.
Yeah.
But the Mutual of Omaha would like hold on to it until they're 18.
What I would do is if you're in that situation, I would have a will or a trust or something, just something that has it in there that's where you want that money to go, so no one will take it. Just on the safe side, it would most likely be put in some kind of account, and then whenever that dependent was of age, they would have access to it.
So we can still write their names on this,
Yeah.
though, and then in the will put it, okay, that it goes there.
Yeah. Yes. Or you can put, you could put two people in there. You could put someone that is of age and then the dependent, and then have in a will or something that you want all the money to go to the person of age to give to the dependent.
Okay.
Yeah. There's been a lot of back and forth about this, but essentially it's our recommendation to you to have a beneficiary in the system so that the money doesn't go into probate and part of it will be gone forever. No matter who claims it or gets the money eventually, the money could diminish
Right.
in volume if you let that go into probate.
Right. All right, we're talking about some good stuff here. Okay, so voluntary life, if you want addition.
Can you go back and explain that age reduction thing? What was that about?
Yeah.
Oh, sorry. So age reduction, so once you reach certain age, 65, 70, 75, 80, the benefit reduces by 35, 60, 75, and 85%.
So the older you
Is that
get, the
common?
less money you get.
Assuming that we all pass away at one point in our life, and usually in our old age.
Reduced. So if I get to 70, the benefits will reduce.
You gonna get fired out?
Yeah.
Very Lord.
Yikes.
The goal is to die before 65.
60, 40, 50.
Yeah, right. You hit age 80. Here's $10.
Yeah.
Okay. So that's why you get additional life insurance. So this is offered to you for you to pay. So for employees, you can elect up to 5 times your salary, up to $500,000. You can elect in $25,000 increments. And so because we're moving insurance carriers, we're moving to Mutual of Omaha, this is a true open enrollment. So if you don't know what that means, it means that so if, let's just say we weren't moving carriers and you didn't elect voluntary life last year, but you wanted to elect it this year, they would make you answer medical questions because they're like, why all of a sudden do you want voluntary life? What do you know that we don't know? So because this is a new carrier and a true open enrollment, you're not going to have to answer those questions. You could just hop on and up to the guarantee issue amount with no questions. If you want to elect over the $100,000 for yourself, you will have to answer the questions, but anything that and under, you won't. And same for your spouse as well. But next year, if you don't elect this year and you want to elect next year, you will have to fill out the questions. So for your spouse, they can elect, has to be your amount or less, up to $250,000. They can get guarantee issued of $50,000, so they can get $50,000 without the questions. And then for your children, you can get them up to $10,000 in increments of 1,000. And this is interesting because there is only one rate for children. So you can have 1 kid or 20 kids, and it's still going to cost you the same, and they're all going to get the benefit. So that's nice. And everyone's like, I don't want to talk about that. Mm-hmm. Okay. Disability. So Capital's offering a voluntary short-term disability plan. So this would be something that you would pay for. So the benefit would be 60% of your weekly income up to $1,500. So this would be a benefit if you think you might be getting pregnant anytime soon, or I don't know, you're just trying to prepare for anything. This is what you would want to sign up for. You would have the elimination period is 7 days for either an accident or an illness. So that just means you would have to be out 7 days before it would start paying, and it would pay up to 12 weeks. So again, this is a true open enrollment, so you can hop on now and not have to worry about answering the medical questions. Any questions?
No, but I did want to point out, guys, so last year, and I saw if you could like pick the amount of STD that you wanted, and we also didn't even offer LTT coverage, but I promise you the wizard is right. You can only elect 60%, so there's only one rate, and it's because there's no like, it doesn't change based on like demographics. So when you go in there and you put it in, it's going to be for the 60% of your weekly benefit, and then that's for STD, and then for LTD, it's 60% of your monthly income. And those are the rates. You can't go up or down.
Right. Sometimes with carriers, they age band it, or they put in certain increments, but with this, it's just one flat rate. So like Rachel said, they're offering voluntary long-term disability this year for the first time. So monthly benefit, 60% of your monthly income, up to $6,000 a month. You'd have to be out 90 days for it to kick in, but if you were on the short-term disability before, that would take care of that. And this could go all the way up to your retirement age. So, you know, God forbid, you're 40 years old and your doctor is saying that you have some type of condition and you can't work anymore. You just have to stay home. So it would pay, the benefit would pay until your retirement age, most likely 65. So it really is, it's your money, it's your saving grace if something were to ever happen to you. I would say disability is the most important benefit that you can have, because you're a lot more likely to become disabled than you are, you know, to die, or before you die anyway. And just like I said before, this is the first time this is being offered, so you can hop on without any questions, but if you want it next year, you're gonna have to fill out some medical questions.
So how much are these? I don't understand.
When you go in iSolve, it'll like automatically calculate it for you. So
okay.
just toggle back and forth. You can click waive benefit or add the benefit, or
Okay.
you can try and do the manual calculation, but why do it if the work's already done for you? Excuse me.
Okay, this is my last slide. So the Employee Assistance Program, it is a program that gets forgotten about a lot. It's included in all of the premiums, so you don't have to pay anything, and anyone in your household can use it, even if you are not on one benefit, you waived everything. It's still available to you. So this is something that it can help you with so many different things. It can help you with, you know, if you need some counseling, you need marriage advice, you need legal advice, you are stressed out at work and you just need to talk to somebody about it. Rachel and Capital aren't going to know who calls in about what. They don't get any type of reporting or utilization. What you would do is either go to the website or call the phone number, which is going to be in the book. It is 24/7, and they can get you in touch with a counselor and find one in your area, and you can actually have 3 face-to-face sessions with a counselor. And so instead of using your medical plan to see a therapist or a psychiatrist, you can use this for free. And it really is helpful. They are certified people, just like any other therapist, psychiatrist, whatever you want to call it. So just if you need help with anything, I would really take advantage of this, because it's a great program and it's free. Just use everything free as much as you possibly can. That's what I do, at least in my opinion.
Yeah. And we don't need to know if you're using it or if you want it. The easiest way for you, if you just can't remember where to find the information for it, for you to keep us out of your personal life if you'd like to. Ideally, we don't want to know really, but not that we don't care about you guys, just we want to keep it so that you guys feel like you can access this resource privately. Just ask us for the benefit booklet. Just say, hey, can you send me the benefit booklet really quickly? It's always going to be in that booklet. We don't need to know why you want the benefit booklet. You could just take a peek at it and then go ahead and contact them, okay?
The booklet's not on.
You can. But like, let's say like
Say
a
you
couple
lost
months,
that.
yeah, later he loses your
Plug
benefit.
in your
Yeah.
phone right
There you go. Plug it in your phone right now, guys.
Yeah, and it really is. I've used it personally through Gallagher, and I was a little apprehensive. I was like, oh, you know, it's probably just going to be like some random person that doesn't know what they're talking about. But it really is a great benefit. So I would really recommend using it if you need it. So I'm done with my part, and now Andrew's going to step in and talk about retirement. If anyone has any questions about any of the health stuff, I'm still going to be on the phone, so let me know. And then Andrew, I guess, let me know how you want me to proceed on the clicking.
Yeah, no problem. I'll tell you when. So, like Macy said, I'm Andrew Beckett. I work for Gallagher as a consultant as well. But while she has the really hard job of doing 24 or so slides, I only have 2 at the very end, so I kind of got the easy part here. So I work with retirement specifically, 401k. So let's talk about what a 401k is, because it can be a little bit confusing. The 401k is just a retirement savings account, and it takes money from your paycheck and directs it automatically into an investment account for you, and it invests. So your money can grow with the market. But the most important part of a retirement plan compared to something like a brokerage account where you could buy and sell stocks in is that the tax treatment for 401k is very favorable. And I'll give you a specific example about that in a little bit, because there are 2 ways that you can do 401k. One of them is pre-tax, and the other one is after tax. And that shows up differently on your W-2 when you pay your taxes. So I'll give you a specific example in a little bit about what that is. But why is a 401k important? Well, the main reason is that Social Security is not going to be enough for most people to live off of in retirement. The average Social Security benefit is $16,500, which I don't know about you guys, but I would not be able to live on that much, especially in retirement. I want to enjoy myself. I work my whole life. I want to travel and do all sorts of stuff. So we need some income from some other place to help us have fun after we're done working, right? So that's the main reason. And the second reason is inflation. Now, a lot of people don't think about this, but I go to the grocery store and I pay for milk and eggs and all that stuff, and I notice that the prices of those things never go down. They always go up, and it's not going to stop either. So the money that you put under your mattress, $100 on one year, the next year, that'll only buy you $97 worth of goods. So that money, that $1,000 is $1,000 forever, as long as it's under your pillow, but the buying power of that goes down. So we want to get interest in market returns to kind of keep up with that, so we're not getting behind. So, Stacy or Macy, can you? I think this slide, yeah. You can do one more. All right. So here's the thing about my industry. They recommend 10 to 15% of your paycheck to go to just 401k. Now, 10 to 15% is a lot of money, for sure, especially when you have kids, especially when they're going to college, especially when you have a house. That's not including medical in that. So I understand that it's unrealistic to expect everyone to defer 10, 15% of their entire paycheck towards 401k. But the most important thing really is to get the match, the employer match. And the employer match, to get the full match, you have to defer 5%. So if you defer 5%, capital is putting in 4% for you. So that's free money right there from capital. It's immediately vested, so if you decide to leave, it doesn't matter. It's all your money. The match is yours. On top of the money you put in there yourself. So I would say you really should defer at least 5%. You can do more than that, sure. But there are also other benefits out there like the HSA, which Macy talked about. Medical costs in retirement, I'm sure you guys know, are really substantial. So an HSA gets a pre-tax benefit as well as 401k. So my recommendation would be maybe not put 50% if you can't afford it, obviously, but to get that 5% so you can get your employer match. And then maybe if you anticipate some medical costs in retirement, go into your HSA. And if you are a really good saver and you can do more than that, then go back into the 401k. Any questions so far? I'll talk about the match and the taxation in the next slide. All right, so this is all the good stuff. Eligibility, contributions, match, distributions. So these are probably the most important high-level aspects. Your plan document, which has all the very specific stuff, is probably like this thick, so we can't talk about the whole entire thing, but these are the important parts. So age 21 and 3 months of service, you're eligible to join the plan. I'm sure everyone in here is age 21, maybe, probably. So you should all be eligible as long as you're not an excluded employee. An excluded employee would be like union employee, contractor, and if you don't work 1,000 hours in a year, you're considered part-time and you can't participate. So hopefully you're all eligible to join the plan. I don't know your specific circumstances, but hopefully you're eligible. And entry is allowed the day you meet eligibility requirements. So literally the 3 months after the day you start, you're eligible to join. So contributions. You can defer 100% of your paycheck if you wanted to the 401k. Never seen anyone do it because that's just ludicrous, but you could if you wanted to. The maximum that you can contribute per calendar year is $19,000. That typically goes up $500 every year, typically. But obviously that'll be in your enrollment booklets, and you'll be able to figure that out next year as well. They update it every year. So. And you, additionally, if you're 50 years old or older, you can actually defer another $6,000, so up to $25,000 if you would. So Roth and pre-tax. This is probably, the funny thing is that even for me, it seems like people don't explain Roth and pre-tax, what that actually looks like on your W-2. So I, of course, pay my own taxes, so I got to experience it firsthand. So let's assume that you make $100,000 a year, and you tell Capital that you want 10% of that to be withheld from your paycheck. So essentially, with pre-tax, the government sees that you put $10,000 in your pre-tax 401k, and they say, "Oh, that's awesome. We're not gonna tax you on that." So when you give your W-2 to the IRS, they say you made $90,000 essentially, and they tax you on that $90,000 instead of the $100,000. But Roth is different. Roth is paying taxes up front, so you don't have to pay them when you take the money out. Pre-tax, you're going to have to pay income taxes on that money when you retire. So even though the government doesn't get their money up front, they get it on the back end. But Roth is nice because you can pay money up front, maybe if you're younger and have a lower income bracket than you expect, and you expect to make more money going forward, you want to pay taxes now. So then when you make more money on the flip end, then you can take it out and not have to pay anything on it. So going back to my example with the Roth, the government's going to look at your income. They're going to say, "Oh, well, you put $10,000 into Roth, but we're going to tax you on $100,000, even though you only saw $90,000 of that in your paycheck." So you get that additional $10,000 is actually taxed up front. But the benefit of that is you don't have to pay taxes on it on the flip end. So when that money is earning market returns and interests, you don't have to pay money on any of that in taxes at the very end. You take it out in retirement. Any questions about that? That's kind of a lot of information.
So there's no taxes on the interest that it's in it wrong.
Correct, if you do the Roth option. So Roth is nice because if you're maybe in your earlier stages of your career, you can say, oh, maybe I don't have kids, maybe you have a little more financial flexibility and I can afford to pay the taxes up front and get all that tax benefit with it. So, but that option is available. One thing to note, I guess, is that match money is never Roth. It's pre-tax money. So, because the way corporations get taxed, it's a little bit complicated, but that match money that you get from the employer is in a pre-tax bucket. It's not in Roth. So, any questions so far? Nope. All right, so the match. The match formula is 100% up to 3 and 50% on the next two. So what that means is that if you decide to defer 3%, capital's going to say, okay, we'll just give you 3% on top of that. So if you deferred 4%, they're going to say, okay, we'll give you the 3% from your first 3 and then 50% of the next 1. So you get a 3.5% match when you put in 4%. And you're still not at the full match. So to get the full match, you have to defer 5%, which is 100% of the first 3%, and then the next 2, you get 1% of that next 2% deferral.
You know, that sounds very confusing.
It does.
Do that one more time.
It's pretty, I found it a lot easier to like explain it like this. Like if you put in 4%, they're going to give you 3%. If you put in, no, sorry, I did that backwards. If you put in 3%, they're going to give you, right?
Yep. So if you put in 3%, they say 100% of the first 3% that you do, and so they give you 3%.
So they match you 100%.
Anything
But then if
after
you
3
do
is
4%, they only give you
Okay.
3.5, and then if you do 5, it's the 4.
So it's just half that.
It's a little
Yeah, it is a little bit confusing. And that match money is immediately vested. So just from my experience, the normal match that you see, that I see at least, is 50% up to 6. So this is objectively a better match because to get the 3% match and the 50% of 6% match, you have to do all 6. Okay,
Now I
just
get
know
it.
that it's good.
Yeah.
Okay, just trust me.
According to the market, this is a good plan.
If something happens, I can come looking for you.
Oh, yeah.
You know, at the end, so like say we go to we're retiring and we're pulling our money out, everything that we put in, if we did the Roth, we don't have to pay taxes on, but everything that they matched us with, we will pay taxes on. Okay.
Yep. And immediately vested, what that means is the money's yours, no matter if you leave the day after you get it or not. So
Yeah.
that's always your money, which is also really great because a lot of other companies have 5-year windows where you have to work 5 years to even get your match. So it's really awesome that it's immediately vested and the formula is really good. So another really nice thing, and I'll give you an example of this, is distributions. So you can take your money out. Distributions is just like an opportunity for you to be able to take money out of your 401k. So when your employment terminates, obviously you can get a check in the mail or roll it over to a different plan, whatever you want. Hardship distribution, if you need to pay for a primary residence or maybe a significant medical event, you can get a hardship. You can apply for a hardship distribution. But the coolest one for me is after age 59 and a half because I recently had this. My boss just turned 60 years old, and her daughter was getting married, and unfortunately, she had to foot the bill for the entire marriage ceremony, which was the wedding, which was extremely expensive. And she couldn't, our plan at Gallagher didn't let her take out money because even though she was 60, it wasn't a plan for her. So she had to pay for that wedding pretty much with her own savings and couldn't take any money out before she could do it. But in the capital plan, you can actually, if you're 59 and a half, you can take a distribution without any penalties at all. So pretty nice. If your daughter gets married or whatever else you need it for.
So if you take it out, you have to pay, there's a penalty fee.
Yep. So
And then you have to pay the taxes on the.
So it's 10%. That's the penalty if you take it out before 59 and a half. And that's an IRS penalty. That's not a capital thing. They don't want you taking the money out. The government doesn't. So, and of course, if you unfortunately die or are disabled, then that money can come out as well.
Who takes it out? Who's allowed to take it out? Would that be your beneficiary?
So yeah, that goes back to your beneficiary, and I'm really glad that actually the beneficiary was mentioned because it feels like every single month we have a situation where a client there's a divorce and someone dies, and then like was mentioned earlier, the ex-wife, the ex-husband gets the money because they didn't update the beneficiary form.
You can update it in Voya.
Yep.
In Voya, like not an iSolve. You have to have a Voya account. If your money's sitting there and you don't have a Voya account and it's just sitting in there, you're one, missing out on some of the cool resources that Voya has, and two, you don't know what's in there. So if I were you, I would go in, do it. You do the beneficiary form. It's super easy. Voya has apps. They integrate with Mint. If you use Mint for budgeting, you can also go on your computer. I can see who's in the plan. So if you have questions about what's in there, I'm a plan, like one of the, I guess the sponsors, whatever account. So yeah, I can go in there and take a peek and look at your stuff. Yeah. So
Was Voya recently brought up?
I don't know.
I gotta think of the mail.
Right, as of right now, they're still Voya to us.
Yeah, I don't think they've been purchased. Usually, if it's a very large company, usually we're the first to hear about something like that. It does happen. So Voya's, I don't think it's been purchased.
I have a question. Speaking of Voya, we've already set up beneficiary and all that stuff. We don't need to change anything. We just leave it. We don't have to do anything since we're rolling.
If you want to keep the beneficiary.
Okay.
Yeah, Voya isn't new. We've had Voya for a year, but we're gonna keep telling you guys about it
Just in
because
case anything changes.
use it as a resource. You can make changes every quarter. There is one thing I want to tell you though. If you leave the company and there's less than $5,000 in your account and they do like a quarterly or yearly audit, they're gonna kick you out of the plan. And it's your responsibility to reinvest that money, or you're going to pay the penalty on the check when you do your taxes. If you have more than $5,000, obviously there's no more contributions are allowed or are able to be made, but that money's just going to sit in there.
And that brings up another point. If you ever update your address or something like that, make sure to have one of those so that check doesn't go to your old apartment or anything.
Yes. So in iSolve, you can update the address and that will go through to Voya.
So that's, you also touched on another thing, which is that you can change your elections on a quarterly basis. So you're going to have, if you do decide to maybe go from 5 to 10% or something like that, that's going to reflect the start of the next quarter rather than the next payroll. So.
Alrighty.
So that's pretty much it. The next slide is just our contact information. If you have questions about the investments or anything like that, feel free to reach out. My email's right there. My colleague Nick Gonzaga's email's right there. And if you haven't enrolled, there's some booklets over there that you can sign or fill out and get involved in.
Yeah.
So.
And it's all online. You just go in and use this information to enroll. Okay.
Good.
All right. Thank you guys for coming. Appreciate it.
Thank you.
All right, Macy. Now I got to figure out if I can end the meeting.
So Macy, I have one more.
Sure.
Because we're starting in October on that HSA, what is the amount that you can put in
Well,
You can.
on the year total? So it just goes from October to October then for that?
Is it calendar year, Macy,
It's
for that?
calendar year.
So it is calendar year, so I would only put in since it rolls over, so it doesn't really matter.
Okay.
But yeah, you can put in the full amount.
Okay. Thank you.
Mhm.